Hi, today Naveen, Mariam, and I will talk about Atridox. What is Atridox? How does it work? Who can administer Atridox? Atridox is a brand name for topical doxycycline, which was approved by FDA in 1998. It's a double syringe system including doxycycline hyclid, 10%, which is 50 milligram doxycycline. It's a flowable and bioabsorbable locally delivered system. It has two systems, and Miriam will talk about that. How does it work? It's a broad spectrum antibiotic with bacteriostatic properties, effective on P. gingivalis, T. forsythia, P. intermedia, and some other bacteria which are associated with periodontal disease and are sensitive to doxycycline. Liquid Atridox, when is in contact with gingival crevicular fluid, it will be solidified and locally subgingival delivery system will be released slowly during the 7 days, and it's considered as an adjunctive with tooth debridement to decrease the pocket depth and regain the attachment. So it's helpful. There are several drugs for improving periodontal disease, so alveolar bone and tissue repairing drugs, inflammation modulating drugs, and antibacterial drugs, which we are talking about that. Antibacterial drugs is in different shape of microsphere, gels, scaffolds, fibers, strips, and films, and nanosystems, and all of them are locally delivered system. And the Atridox is one of them. This picture shows doxycycline and chlorhexidine activity is higher than the other locally delivered system and effectiveness. This video shows the how does it work.
In the healthy mouth, gums are pink and close to the tooth. When probed, there is no bleeding, and the probe typically reaches in 3 millimeters or less. With periodontitis, the gums begin to recede and pockets develop between the gum and the tooth. This is due to the presence of bacteria, most often a group of bacteria, including P. gingivalis and T. forsythia. When probed, the gums bleed and the pockets can be 7 or more millimeters deep. An antibiotic such as doxycycline can kill the bacteria and help the gums become healthy again. In the past, there have been problems with administering an antibiotic to periodontal pockets. The difficulty was obtaining access to the bottom of the pocket and preventing the fluids in the pocket from washing it away before it has a chance to work. Now, with the unique gel delivery system of Atridox, this is no longer an issue. Atridox is a subgingival controlled release system composed of a delivery system, which is a bioabsorbable, flowable polymer gel combined with a doxycycline hyclate powder. When mixed, Atridox becomes an easy-to-apply gel that flows to the bottom of pockets and fills even the smallest spaces between teeth and gums. On contact with the crevicular fluid, the liquid Atridox solidifies and then allows for controlled release of the drug for a period of 21 days. Only Atridox is clinically proven and indicated to achieve all three of these outcomes: gain in clinical attachment, reduction in probing depth, and reduction in bleeding on probing. Additionally, Atridox has been shown to reduce the levels of red complex bacteria that are associated with periodontal disease for at least 6 months.
I hope you guys enjoyed the video and now you have a better understanding on how the Atridox work. So the Atridox have been approved of treating adults with a chronic periodontitis, and we use it to achieve an improvement in the clinical attachment, reduction in probing depth, and decreasing in bleeding on probing. For the contraindication, people with a hypersensitivity to any tetracycline class medication such as doxycycline, and people who are pregnant or nursing, it's considered to be category D, children under the age of 8, as if it's due to a change in the color of the developing teeth. The main advantages of the Atridox is safe, convenient, producing a longer duration of action, offer a non-invasive, painless, simple application, and the most important one is avoiding the GI tract problem, which we have when we take systematic antibiotic. Main disadvantages, it's gonna need a longer chair time, development of the bacterial resistance, more expensive, and the hypersensitivity. Adverse reaction, possibly allergic response and oral candida, and a possible of development of a bacterial resistance. The candida is mainly, as we said before, that the excessive use could have lots of adverse reactions, such as the excessive growth of the organism that is not susceptible to it, such as the fungus. So it is advisable to regularly monitor for any possible excessive development as observed with other type of antibiotic. Main precaution is pregnancy and severe periodontal defects. It haven't been proven till today clinically that it does affect pregnant and nursing women. But in all cases, we have to be extremely careful as it is considered to be category D. There is no research in people with a very severe periodontal defects and a very little periodontium. Immunocompromised patient with a weaker immune system, such as diabetes, cancer, radiation therapy, and HIV, we have to be extremely careful with this group of people. For the oral candidiasis, we must be extremely careful with the people who are susceptible to have candida and they have a mouth candidiasis. No proof on the safety or the unusableness of the Atridox for the treating of the periodontitis in people with an oral candida. But in all cases, it is one of the side effects of the use of the Atridox as of most of the antibiotic, which is the formation of the fungus in that spot. And in this case, it's the mouth. For the pregnant women, we have to be extremely careful, and we have also to always ask any woman who would come to the clinic and making sure she's not pregnant. The dosage of the Atridox, there is so many factors that determine the dose of this medication, the shape, the size, and the quality of the pocket. What is the MIS? So the MIS is the minimum inhibitory concentration of the doxycycline, referring to the lowest concentration of the antibiotic that inhibit a visible growth of microorganism. For the MIS for the periodontal pathogen, it should be less or equal 6 microgram per milliliter 2 through day 7. The subject is going to receive a GCF, a gingival cervical fluid peak of 2.5 micrograms per milliliter at 12 hour, declining level 0.2 microgram per liter by day 7, and the blood concentration of the doxycycline should never exceed 0.1 microgram per milliliter.
And now who can administrate doxycycline? Actually, it can be used by dental hygienists in conjunction with scaling and root planning to treat chronic periodontitis. For preparation of this gel, actually there are some steps that we have to follow. The refrigerated product should be out of the fridge for at least 15 minutes. And as you can see in this picture, actually we have two syringes, syringe A and B. Join the syringe B that contains the drug powder, and syringe A that has a red strip on it, and it contains the liquid material. Inject the contents of syringe A into syringe B, then push the contents back into syringe A. There is only one mixing cycle in the whole process. Use quick strokes to finish 100 mixing cycles at a speed of 1 cycle per second. Maximum time to keep pair syringes is 3 days in the room temperature, and just before using, always remember do 10 more mixing cycles after storage. Place syringe A at the bottom of the connected syringe and hold them vertically. Allow the contents of syringe A to run down the barrel for a few seconds, just by pulling back on the plunger. And finally, disconnect the two syringes and fit syringe A with one of the supplied cannula. In this photo, you can see all the steps, and there are two syringes that they are mixing the powder and liquid together. And after, we are gonna have the cannula that is used for delivery of the material. And there are some important information that should be delivered to the patients. One of them is caution on oral hygiene. Following the doxycycline administration, we need to inform patients avoid mechanical oral hygiene practices like brushing, flossing in the treated area for 7 days. Avoid long-term exposure to artificial UV light or the sun during doxycycline therapy. And also there are some possible reduction in the effectiveness of birth control tablet by doxycycline. So consultation with a medical expert can be necessary. And there are some references, and I hope you enjoyed this information.